session today. Um, so in this session, inshallah, we'll be talking about the mediastinum, and we'll also talk about CT cross sections because they're two very related lectures. So my goal with this lecture, inshallah, isn't to just list what's in the mediastinum and just show you the CT images. Hopefully, we'll try to actually understand and visualize the structures and how they lay around the heart, and hopefully that will make it a lot easier to memorize later. And for CTs as well, I'll show you easy ways to identify and orient yourselves around different cross-section levels. So let's get started. Inshallah, in this lecture, we'll talk about mediastinum, the contents of the mediastinum, some clinical cases, and obviously cross sections from CT scans. So first of all, what's the mediastinum? I won't take too long on the introduction because it's simple enough. The mediastinum is the space between the two pleural sacs. So we can basically say that it's the space between the lungs. And this is where the heart and all the structures surrounding the heart are present. So the mediastinum is divided by the sternal angle, and we'll talk more about the sternal angle in a bit, but it's divided into a superior mediastinum and an inferior mediastinum. And just because medicine likes to complicate stuff, the inferior mediastinum is further divided into an anterior mediastinum, middle mediastinum, and a posterior mediastinum, okay? And at the front, you have the sternum, and at the back, you have the vertebra, okay? So the sternal angle, it's basically a level that forms just at the manubriosternal joint. So where the manubrium and the sternal body join. This level right here is called the sternal angle, and it's always at the level of the second rib, and behind it's at the level of T4, T5 vertebra. So exactly in between T4 and T5. And why this level is so important is because it's the same in all human beings. Whether you were an adult, an infant, you were just born, this level is at the same level, at the sternal angle, at the level of the second rib and the vertebra. And this is important because since we have a constant reference point in all human beings, we can use it as a clinical guide to number the ribs, the intercostal spaces, and many other things, okay? So this is why the sternal angle is important. So it's very important to remember the second rib and vertebra T4, T5. So what are the significances of sternal angle? The first one, as we said, that it divides the mediastinum into superior and inferior. The second significance is that it's the beginning and the end of the aortic arch. And the third significance is that it's the level of bifurcation of the trachea. And we'll talk more into detail about this once we get into the contents of the mediastinum. But all clear until now?
Yes.
So the contents of the mediastinum. Now, instead of memorizing them, we can simplify it in a very easy way. Around the heart, we can have only four things, okay? Either blood vessels, so arteries and veins, esophagus and the trachea, nerves, and lymphatic organs, okay? So all the structures around the heart is one of these things. And so if we know exactly how each one of these structures run around the heart, we don't need to memorize which structure is where, okay? So in order to simplify stuff, I'll be using my drawings. Excuse the drawing, but it will make things simple, inshallah. So this side is the right side. It's very important to orient ourselves around the side. So this side is the right side. So your left side is the right side over here. Just imagine this person is looking at you. So your left, if you're looking at a person, it will be their right, okay? And the same over here, your right is their left. Now this line over here represents the sternal angle. So anything above is
Superior mediastinum.
what can we call this level over here?
Superior.
Superior mediastinum. And anything under is the inferior mediastinum. Okay. Now this is the heart, obviously. And the heart, the first thing you need to know is that the heart lies in the middle mediastinum. And that makes sense because the heart is the major organ and the central organ. So just memorize it like this. The heart is in the middle, okay, in the middle mediastinum. Now let's see how the structures lie around the heart. So first, let's talk about arteries, okay? So this is the main artery of the body. It's the aorta. And its path, it leaves the heart, the left side of the heart, okay, and until it reaches the sternal angle. it starts arching backwards and downwards like this, okay? So any dotted line means back in the posterior, okay? So it starts running backwards and downwards, and then continues down as the descending or the thoracic aorta, okay? So this part of the aorta, where it leaves the heart directly, we call the ascending aorta. This part of the aorta we call the arch of the aorta because it arches. And then this side, this part of the aorta we call the descending aorta or the thoracic aorta because it's descending, okay? And another rule to remember, any root of great vessel lies in the middle mediastinum. So because the heart lies in the middle mediastinum, any artery or vein that enters or leaves the heart directly is also in the middle mediastinum because it's right next to the heart. So in the case of the aorta, the part of the aorta that's in the middle mediastinum is the ascending aorta. Why is that? Because it leaves the heart directly. We call this the root of the aorta as well, because it's where the aorta leaves the heart, okay? And then we have the arch of the aorta. It's above the sternal angle. So we call it, we say that it's in the superior mediastinum. And you remember one of the significances we just spoke about for the sternal angle? It's the level of the beginning and end of the aortic arch. So now you understand what that means. Beginning and end. Okay, so the aorta starts arching right at the level of the sternal angle, then stops arching again right at the level of the sternal angle. Okay. So this is for the aorta. Now let's talk about the branches of the aorta. We have three branches, as you all know. The brachiocephalic trunk, and the name is so easy. Brachiocephalic. Brachio means arm. Cephalic means head. So it's the artery that supplies the arm and the head. Okay. Then you have, and this is why it splits into the right common carotid, which supplies the head, and the right subclavian, which supplies the arm. And again, the name subclavian is it's called that because it's the artery that runs under the clavicle. So subclavian. Okay. On the left side, we don't have the brachiocephalic trunk, but we directly give off the left common carotid artery and the left subclavian artery. Now, does anyone know why we have brachiocephalic trunk on the right side, but no brachiocephalic trunk on the left side?
Because her heart is tilted towards left side.
Can you repeat that, sorry?
Because heart is tilted towards left side.
Okay, that's not a bad answer. It's a good attempt. So it's because the aorta is on the left side. Okay, that's the main reason. And the brachiocephalic trunk, it just acts like a connection or a bridge from the left to the right side. Because the aorta, in order to reach the right side, it needs to go a longer way than what it needs to reach the left side, since it's already on the left side. So the brachiocephalic trunk acts as a bridge or a connection for the aorta from the left side to the right side. However, it doesn't need a connection to the left side because it's already on the left side. And so it directly gives off the branches, the left common carotid and the left subclavian. Okay. So this is a way to remember it if you ever forget. And if you ever get confused, is the brachiocephalic trunk on the right or on the left? It's only on the right side. And obviously, all of these branches of the aorta, they're all in the superior mediastinum because they're all above the sternal angle. Okay. Now, this are the images on your slides. This is the arch of the aorta, and this level we can say is the sternal angle over here, and it gives off three branches. This is the brachiocephalic trunk, this is the left common carotid, and this is the left subclavian artery. And you can see the same thing over here. Now, we finished talking about arteries. Let's talk about veins. Do you guys know what this vein is?
Superior vena cava.
This one is superior vena cava. And what about those?
Left and right brachiocephalic vein.
Excellent. So again, from the name, brachiocephalic means that it drains the arm and the head, okay? And we have a left and a right brachiocephalic vein. And obviously here we have superior vena cava. Now, why is the left brachiocephalic vein longer than the right brachiocephalic vein? actually very similar to the reason why there's a brachiocephalic trunk on the right side, but none on the left side. It's because the superior vena cava is on the right side. So in order to get to the right side from the left side, you need a longer bridge, which is the left brachiocephalic vein. However, on the right side, it's closed. So that's why the right brachiocephalic vein is not long. Okay, it's shorter than the left brachiocephalic vein. And this is a very important identifying feature when we come to the CTs, okay? That the left brachiocephalic vein is longer than the right brachiocephalic vein. So this is another image. This is the left brachiocephalic vein, and it forms from two veins, one that drains the head called the internal jugular, and one that drains the heart called in the arm called the subclavian. Again, the name comes for the same reason, under the clavicle, okay? And there are important identifying features between the right and the left. The left obviously is longer and it's more diagonal, okay? This one is more vertical. This one is more diagonal or horizontal, okay? This is an important identifying feature as well. Okay, so, and obviously this is the superior vena cava. Now, where is the superior vena cava? Which mediastinum?
Middle mediastinum.
Excellent. Why? Because that follows the rule of all the roots of great blood vessels are in the middle mediastinum. Since it directly joins the heart, it's automatically in the middle mediastinum. And what about the brachiocephalic veins?
Superior mediastinum.
Superior mediastinum. And then for what about the subclavian and the jugular veins?
All is in the superior, right?
Okay, this was a trick question. The jugular and the subclavian veins, they join before entering the mediastinum. So they're not in the mediastinum. Okay, the first vein coming from above that's in the mediastinum is the brachiocephalic vein. The jugular and the subclavian veins are not in the mediastinum. Okay, don't get yourself confused. Same goes for the this part of the subclavian and this part of the common carotid. They're not in the mediastinum. However, since they join the aorta directly, this part of them is in the mediastinum. Okay, but the veins, they're not in the mediastinum, the jugular and the subclavian veins. However, the arteries are. Okay, this is very important. So now let's talk about more veins. This vein, it's called the azygos vein. It drains the posterior aspect of the thoracic cage or the thoracic cavity. Okay, any dotted line we said is posterior, tamam? So which mediastinum is the azygos vein in?
Posterior.
Posterior and inferior mediastinum. Excellent. But you'll notice something, that the azygos vein is posterior, but this part over here is not dotted anymore. Okay. Now this part is separate from the azygos vein, and we call it the arch of the azygos vein. It's not in the posterior mediastinum anymore, because can imagine with me that the azygos vein is at the back, okay? But it needs to join the superior vena cava. It needs to drain in the superior vena cava, so it needs to arch forward. So this arch is called the arch of the azygos vein. And which mediastinum would this be in?
Middle.
Middle mediastinum. So this is one of their favorite questions. They'll try to trick you by saying arch of the azygos vein instead of azygos vein. Azygos vein is in the posterior, but the arch of the azygos vein is in the middle. Okay. Now, this is another vein. It's the azygos vein, little brother. It's called the hemiazygos vein. So the azygos vein drains the right side. The hemiazygos vein drains the left side from the posterior aspect of the thoracic wall. Okay. And it doesn't join the superior vena cava directly. It joins its big brother, and then they together go to the superior vena cava. Okay. So all the hemiazygos vein, all of it is in the posterior, but the azygos vein, the arch of it is in the middle. Okay. So this is the picture in your slides. This is the azygos vein. It drains the right side of the posterior aspect of the thoracic cage, and it joins the superior vena cava over here. This part is the arch, and this is the hemiazygos vein. It joins the azygos vein before it reaches the superior vena cava. Okay. This is a question. Which structures are at highest risk when performing a sternal puncture? Sternal puncture is basically inserting a needle in the manubrium part of the sternum, so right above the sternal angle. Which structures do you think are at highest risk?
Left brachiocephalic. And then arch of aorta.
Excellent. So if we insert a needle over here, just above the sternal angle over here, will damage the brachiocephalic vein. And the left brachiocephalic vein is the most anterior structure in the mediastinum, in the superior mediastinum. It's the closest to the sternum, okay? So that's why it's at very high risk. However, if we put the needle over here and we go even deeper, then we might damage the arch, the aortic arch, or the arch of the aorta, okay? This is a very nice image you have in your slides. If we insert the needle too much over here, will damage the left brachiocephalic vein. And if we put it too much over here, then we'll damage the arch of the aorta. And again, remember that the most anterior structure just behind the sternum or the manubrium is the left brachiocephalic vein. Okay. Now we spoke about arteries and veins. Let's talk about the esophagus and the trachea. Okay. Now this is the esophagus. Now another rule to remember: anything that's going from up to down will cross two mediastinums, the superior mediastinum and the inferior mediastinum. Now, which part of the inferior mediastinum it will cross depends on its positioning. Okay. So what can you tell from this drawing over here, the esophagus? It comes from up to down, crosses the superior mediastinum, and then where does it go?
The inferior.
Yeah, but which part of the inferior?
I think it's middle because it's just behind the heart because it gets compressed easily, I think.
What did we say about the dotted line? Anything that's dotted is posterior على طول. Okay, the esophagus is صح, it is behind the heart, and it's in the posterior mediastinum. Okay, and it does get compressed when the left atrium is dilated or enlarged. That's true, but that doesn't change the fact that it's in the posterior mediastinum. Okay, but that's good thinking. Okay, so the esophagus comes from up to down, crosses the superior mediastinum, and goes and continues into the posterior mediastinum because it was already posterior. Now, this is also a very important identifying feature of the esophagus, because when we're coming to look at the cross sections from the CT, you'll notice that the thing that's always the most behind, next to the vertebra al طول, is the esophagus. Okay, this is a good way to remember it. Now, the trachea, it goes with the esophagus back to back. Okay, it's esophagus front, esophagus behind, and then right in front of it, sticking to it, is a trachea. Okay, but then the trachea, what did we say one of the significances of the sternal angle is that it's the point of the bifurcation of the trachea. This is what bifurcation means: splitting of the trachea into the right main bronchus and the left main bronchus. This happens right at the level of the sternal angle. Okay, this is also very important to remember when we're coming to the cross sections of the CT. Okay, and remember also that they're sticking to each other. They run together until the sternal angle where they go apart, the right main bronchus and the left main bronchus. Now, where is the right and the left main bronchus? Which mediastinum? This time it's in the middle mediastinum. Why? Because it's not dotted, obviously. And you can imagine, we said that the mediastinum is the space between the two lungs. Where are the bronchi going? They're going into the lungs. Okay, so the lungs are not right next to the heart. And so the main bronchi are in the middle mediastinum, and the esophagus is in the posterior mediastinum. And this is also very important when you're coming to the CT. You'll notice that the trachea and the bronchi are always in front of the esophagus. Okay. Now we spoke about the esophagus and trachea. Let's talk about the nerves. Okay, there are two main nerves that are in the mediastinum: the phrenic and the vagus nerves. Okay, so the phrenic nerve, as we said, it's coming from up to down, so it will cross two mediastinums, the superior and the inferior mediastinum. Now, is this in the middle or in the posterior mediastinum? The phrenic nerve. What do
I
you
think
think?
it's middle.
Middle mediastinum. Okay, and The way structures run around the body, it always has a reason. Okay, it always has a link to its function. The phrenic nerve has to run in the middle mediastinum. Why? Because it's supplying something in the middle mediastinum. What do you think that is? The heart. The pericardium of the heart is supplied by the phrenic nerve, and that's why the phrenic nerves run in the middle mediastinum. Okay, so if you ever forget, just remember that the phrenic nerve supplies the pericardium. Where is the pericardium? And the middle mediastinum. So the phrenic nerve also has to be in the middle mediastinum. The second nerve is the vagus nerve. What's the difference you noticed? So that the vagus nerve goes into the posterior mediastinum. It's behind the phrenic nerve. Okay, and as we said, the way structures run in the body, they have to supply something. So the vagus nerve, what do you think it supplies if it runs in the posterior mediastinum? What other structure we mentioned is in the posterior mediastinum? The esophagus, okay? So another way to remember this, you can say esophagus, okay? So the vagus supplies the esophagus, and that's why it's in the posterior mediastinum, okay? Now we spoke about the nerves. The only thing remaining is lymphatic organs. 1 second, the laptop's acting up. So now let's talk about lymphatic organs. There are only two lymphatic organs that we need to worry about. The first one is the thymus. This one is very easy to remember because it's an exception. The thymus is the only structure that's present in the anterior mediastinum. Okay, so you can memorize it like that. It's the only structure that's present in the anterior mediastinum. Sometimes you can have some remnants of the thymus in the superior mediastinum over here, but most of it and the functioning part of it is in the anterior mediastinum. Okay, and the second lymphatic organ is the thoracic duct. Now, this is the main lymphatic vessel of the body. It starts from the abdomen, from this dilation called the cisterna chyli. Okay, now, but then it enters the thorax through the aortic opening. Which level is the aortic opening? Does anyone remember? Where does the aorta go into the abdomen? At which level? Which vertebral level?
B12.
T12.
T12, excellent. So the thoracic duct enters the thorax with the aorta at T12, okay? Then it goes up and then it drains into the left venous angle, okay? So the left venous angle, it's the junction of left internal jugular and left subclavian vein. So it's the point at where the left brachiocephalic vein forms. Okay, this is called the left venous angle, and this is where the thoracic duct drains. Okay, so the thoracic duct runs in the posterior mediastinum and then obviously goes up to the superior mediastinum. So everything we mentioned before comes from up to down, but this goes from down to up. Okay. So this is just a summary I made. You can refer to it later of all the structures and where they lie in the mediastinum. So now let's talk about some clinical cases. What do you guys think this is? What do you think this image is showing? So you can see the pulmonary trunk and the aorta, and there's something connecting in between them, so? Sorry guys, my mouse is not working well, so you're just gonna have to imagine what I'm saying. So this is the pulmonary trunk. 1 second. Yes, and this is the aorta, okay? And there's a connection between them. This connection is called the ductus arteriosus, okay? And now this normally it degenerates in adults or at birth, becomes the ligamentum arteriosum. If it doesn't degenerate and if it doesn't close, if it remains open, we call the clinical case patent ductus arteriosus, okay? So what happens in patent ductus arteriosus? Some patients, it remains open, okay, and it causes a machine-like systolic and diastolic murmur. So you're hearing the murmur the whole time in systole and diastole, and it's machine-like, okay. Now this is a left to right shunt. So the blood moves from the aorta to the pulmonary trunk, okay, and that's why it's non-cyanotic, because oxygenated blood is moving into deoxygenated blood. since the blood in the pulmonary artery is deoxygenated and the blood in the aorta is oxygenated, moving blood from the aorta to the pulmonary artery will not cause cyanosis. However, if it was a right to left shunt, if the blood flow was going from the pulmonary trunk, which is deoxygenated, into the aorta, which is oxygenated, it will decrease the oxygen levels in the aorta and it will lead to cyanosis in peripheries. Okay, so cyanosis is the blue color caused by hypoxia. So is that point clear? However, in the case of ductus arteriosus, the shunt is from the left to the right, so there is no cyanosis. Okay, and there is an increased risk of patent ductus arteriosus in babies of mothers who have rubella. Okay, so this is also a high yield question. It gets asked a lot. Patients with rubella, mothers with rubella, their kids have a higher chance of getting patent ductus arteriosus. Okay. Now, another very important clinical case. This is the aortic arch, and what nerve is this?
Vagus.
Vagus nerve, excellent. Now the vagus nerve gives off a branch in the superior mediastinum that's called the left recurrent laryngeal nerve. Okay. Now this left recurrent laryngeal nerve, it goes under the aortic arch. Okay, between the aortic arch and the pulmonary trunk. Okay, and if we say that, for example, we have a dilation or a dilatation of the aortic arch becomes big. What do you think will happen to this nerve? It will get compressed between the aorta and the pulmonary trunk, leading to hoarseness. Why? Because this recurrent laryngeal nerve, let's break down the name, left because it's on the left side, recurrent, any nerve that goes in the opposite direction of what gave it. So the vagus nerve is going from up to down. Now this nerve came off the vagus nerve, but it's going in the opposite side of the vagus nerve. So we call it recurrent. And laryngeal, the larynx is the organ responsible for speech. So this nerve, it supplies the organ responsible for speech. If this nerve loses its function, you won't be able to talk. And that's simple as that, okay? So in the case of aortic arch aneurysm, where there's a dilation of the aortic arch, the left recurrent laryngeal nerve will get compressed, and that will lead to hoarseness, okay? And it's also at great risk when we do a surgery for patent ductus arteriosus, which is right here in the same area the recurrent laryngeal nerve is in. Okay, if sometimes when we want to do a surgery on the ductus arteriosus to close it, we may damage the left recurrent laryngeal nerve by mistake. So it's at great risk when you have a surgery for the patent ductus arteriosus. Okay. So they may give you a clinical case where a baby had a patent ductus arteriosus and suddenly wasn't able to speak, and they'll ask you which nerve got damaged, and so or which structure got damaged, and you should know that it's the left recurrent laryngeal nerve. Okay. This is a practice question. A 45-year-old woman presents with a tumor confined in the posterior mediastinum. This could result in compression of which of the following structures? Here. B's. Very good job. The answer is B, because out of those, the only structure that's in the posterior mediastinum is the descending aorta. And why is D wrong? Isn't the azygos vein in the posterior?
Because the arch of the azygos vein is in the superior.
Good job. That's another question. In which of the following compartments does the pulmonary trunk exist? For some reason, I can't read the chat. One second.
B.
B, excellent. Why? Because we said that the root of the great blood vessels, they're all in the middle mediastinum. The pulmonary trunk, it leaves the heart and directly goes to the lung. Okay, so the root of the pulmonary trunk is at the middle mediastinum, and also the right and left pulmonary arteries are also in the middle mediastinum because they go right and left directly to the lungs, okay, which lie right next to the heart. Excellent. So this was it for the mediastinum. Does anyone have any questions? So now let's talk about CTs or cross sections. So when looking at the CT, it's very easy to get lost, especially under the stress of the exam. So you always want landmarks or steps and a method to go through when looking at CTs, okay? So the first thing you want to do is you want to orient yourself on the directions. What's anterior, what's posterior, what's right, and what's left, okay? So you're looking at this patient from below. So the right and the left, again, they'll be inverted. In any kind of imaging, most of the time, your right is the left and your left is the right, okay? So this side will be the left and this side will be the right, okay? So that's the first thing to do. Now, what's anterior and what's posterior? You can do this in two ways. The easiest way, and my personal favorite, is you look at the vertebra. This obviously is at the back. So خلاص, this is posterior and this is anterior, and this is the sternum bone, as you can see. So you can also use that. You can either use the sternum or the vertebra, okay? Now, a very useful thing to do to determine which level you're at is look at the arteries, okay? So these are the arteries. Now, the arteries, they have a very specific shape at each level. Now, can anyone guess what level this is? Or at least tell me if it's above the sternal angle or below the sternal angle. Are we in the superior mediastinum or the inferior mediastinum?
I think about
Above. Excellent. Why do you think that?
because the trachea didn't perfecate yet.
Okay, excellent. That's one point. Does anyone have any other point?
The subclavian are here, and we can see the common carotid and
Yes, excellent. The arteries, okay? So this is actually T3, so it's way above the sternal angle. Sternal angle is T4, T5. So we still have to cross T4 and then we can see the sternal angle, okay? So there are many reasons we can know we can know for a fact this is above the sternal angle. One is the trachea. It didn't bifurcate, okay? You can see here, it's only one trachea. But some people may get confused and think this is a vein. So what's a better way to do it? The arteries. This pattern of arteries you won't see unless you're at the level of T3. This is the brachiocephalic trunk on the right side. Okay, this is the left common carotid, and this is the left subclavian artery. When three of them are lying together like this, that means you're way above the sternal angle because you're not even at the level of the aortic arch, let alone the sternal angle. Okay, you're above the aortic arch. So this is the left brachiocephalic vein, and this is the right brachiocephalic vein. And again, as I said, you'll notice that the left brachiocephalic vein is much bigger than the right brachiocephalic vein, صح? And also you'll notice that it's the most anterior structure right behind the sternum. So can you guys link the information now between CT and the mediastinum lecture? And as we said, this is the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. And this is the esophagus. Again, I told you guys the esophagus is the most posterior, and it's right next to the vertebra always. So this is a nice identifying feature of esophagus. And I also told you guys that the trachea and esophagus are friends. They run together right in front of each other. So this is the trachea, okay? And obviously, because the trachea is the airway, it's always wider than the esophagus, which is only open when you're eating. And obviously, this patient isn't eating right now, so that's why the esophagus is always closed and compressed, while the trachea is open. Okay. So let's look at this in another image in the anatomage. What's this? What do you guys think this is?
left brachiocephalic vein.
Yes, excellent. Because we're right behind the sternum. And what do you guys think this is?
Right brachiocephalic vein.
Right brachiocephalic vein. And these are the arteries. Okay. And is this the esophagus or the trachea? What do you think?
Esophagus?
Esophagus, excellent. Why? Because it's the most posterior. It's right next to the vertebra. Okay, and this is the trachea, and you can see the C cartilage. Okay, the C-shaped cartilage over here. And this is the esophagus. Okay, this image is clear, صح? Level T3. Okay, so for this image, you can imagine that we took a slice from here, right here. Okay, so if you took a slice from here, obviously you'll be able to see three circles, one for this, and one for this. Okay, what if we take a slice from here? How many aorta will you see? How many arteries will you see? S- So so this is another image. We took the cut from here. Okay, so we're at the level of the arch of the aorta. Okay, so if we take the cut from here, then we'll be able to see only one artery. Now this is an identifying feature of this image. Okay, or T4, right above the sternal angle, you'll see one arch of the aorta. You can't see those anymore. خلاص, we went below them. Okay, and you'll see the arch of the aorta. You'll see the superior vena cava this time. Okay, and you'll see the azygos vein trying to join the superior vena cava. You'll see the trachea, and then again the esophagus right here at the back. Okay, so that's why I said always look at the arteries. The pattern of arteries is very helpful to know which level you're at. If you see three separate arteries, then you're at T3. You're way above the sternal angle. If you see one full artery, you're at the level of the arch of the aorta, and that's just above the sternal angle at T4. You can't say I'm at the sternal angle yet, because what did we see happens at the sternal angle? The end and the beginning of the aortic arch. So if I take a slice at the sternal angle, then I'll see two arteries, the ascending and the descending aorta. I won't see one full artery. I'll see two. Okay, and so all the structures here are clear. Let's see it in the anatomage. This is an artery. A very nice way to differentiate between arteries and veins, if you ever get confused, is look at the artery. It had a very thick wall, and it looks like rubber, okay, because it's elastic. However, the vein, it doesn't have a thick wall, and it's very large and dilated because
To do that, you'll need to be online.
sorry. Okay, so this is the arch of the aorta, as we said. This is the superior vena cava. This is the trachea again, and this is the esophagus. Trachea and esophagus are easy to identify. Esophagus is always next to the vertebra, and right in front of it is the trachea always. But be careful, because the trachea will not always be there. The trachea will bifurcate, and once we go down or below the sternal angle, the trachea will no longer be there. So always check if you're above or below the sternal angle. If you suspect something is a trachea, make sure you're above the sternal angle. Okay, don't make that mistake in the exam. Now, which level are we in right now? Can anyone guess?
T4, T5, it's the sternal angle.
Excellent. You're
Exactly.
at the sternal angle, exactly. Good job. Okay, so let's try to correlate what we learned. The sternal angle, first of all, divides the mediastinum, and it's the beginning and the end of the aortic arch, and it's also the level of bifurcation of the trachea. So does that all happen over here? Yes. We have the beginning and the end of the aortic arch. Okay, so the end of the ascending, and the beginning of the descending aorta. And look at the aorta. It's always has this rubber shape, and it always has a thick wall. Okay. Uh, this is the descending aorta. This is the pulmonary trunk. Us, we can start seeing the pulmonary trunk. We can't see it fully, but we can just start seeing it. And the most important feature is the bifurcation of the trachea over here. And what structure is this?
Esophagus.
Next to the esophagus. Excellent. Good job. Now, this is the level of T5. We went just under the sternal angle. The identifying feature for this level is the inverted Y. Because as soon as you see the inverted Y sign, you know that you're at the level of T5, okay? So guys, in the exam, always for each image, don't just try to memorize blindly. Look for an identifying feature. Because trust me, in the exam, under the stress, you'll start forgetting. And because right now we're studying it in order, it's a bit easy. But in the exam, they may give you the first one, they may give you the last one, they may give you only something in the middle. So always try to memorize the most identifying feature of each level, and that way you'll be okay. So for this one, it's the bifurcation of the trachea. For this one, it's the big aortic arch, okay? And for this one, it's for T3, it's the three arteries, the pattern of three arteries, okay? طيب okay, so what do you guys think this is? What's the inverted Y? Any guesses? Okay, so the inverted Y is the pulmonary artery. Okay, this is the pulmonary trunk, the one in the middle. This is the pulmonary trunk, and it splits into the right pulmonary artery and the left pulmonary artery. How do you know which one's right, which one's left? Simply, this one is going to the left side because, as we said, this is the left side. So this one's going to the left side, so it's the left pulmonary artery. This one will rotate and go to the right side, so it's the right pulmonary artery. Okay, now this is a superior vena cava again. I mean, this is the ascending aorta. This is the descending aorta. This is the superior vena cava. This is the right main bronchus because خلاص we split already. This is the left main bronchus. This would be the esophagus, and this is the azygos vein. Okay, because this is the posterior mediastinum below the sternal angle, so expect to see the azygos vein in all the remaining images. Okay. So, this is just the anatomic version of the CT. The right pulmonary trunk, left pulmonary trunk, descending aorta, ascending aorta, superior vena cava, right main bronchus, left main bronchus, esophagus, and this is the azygos vein over here. Okay, and this is the pulmonary trunk, where it gives off the right pulmonary artery and the left pulmonary artery. Don't get mixed up in the exam and say this is the pulmonary trunk. This is a very common mistake. Since this is the biggest, people think it's the pulmonary trunk. This is the pulmonary trunk, and it gives off the right pulmonary artery and the left pulmonary artery. Okay. So just think of it as that the pulmonary trunk comes from the middle. This comes from the right side, from the left side. So it's definitely not the trunk. The trunk comes from the middle. Okay. Now, T7. This is the last CT image you need to know. This is the heart. خلاص. At this level, you can see the heart. It's a cross section of the heart and the chambers of the heart. Okay, so which chamber do you guys think this is? Number one.
Right?
The right ventricle. Excellent. Why? Because the right ventricle is the most anterior in the heart, صح? And it's right behind the sternum. That's why a very common question is uh, uh, someone got stabbed in the anterior chest wall. Which part of the heart is most likely susceptible for injury? And it's always the right ventricle. Why? Because it's right behind the sternum and it's the most anterior. That's why it's the most susceptible for injury. Okay. Now, the right ventricle, what opens into the right ventricle? Obviously, the right atrium. Okay. The right atrium. What's this number three? What's the valve between the right atrium and the right ventricle? The tricuspid valve. Okay. So, and this is the left ventricle. And what's the valve between the left atrium and the left ventricle? The bicuspid valve. Now, a very common mistake, people think this is the right ventricle, this is the right atrium, and this is the left ventricle, this is the left atrium. That's wrong, okay? Because remember, I will say the left atrium is the most posterior and it opens into the left ventricle. خلاص, this is the left ventricle, okay? And this is the mitral or bicuspid valve. And what vein comes out from the left atrium? the pulmonary vein. Okay, and here you'll see the descending aorta, خلاص, because at all levels below the mediastinum, you'll see the descending aorta. We no longer can see the ascending aorta, خلاص, okay? And this is the esophagus again, and this is the azygos vein, number 8. All clear. This is the anatomage. Uh, Obviously, this is the left ventricle, right ventricle. Always start with the right ventricle. The most anterior is the right ventricle, left ventricle, right atrium, left atrium. This is the mitral valve, tricuspid valve, esophagus, descending aorta. This is the azygos vein. Now, also a common mistake people fall in, they say this is the right ventricle. Since it's bigger, how can the atrium be bigger than ventricles? It's not like that. It's just the way the cross section was taken. But always just refer to the right ventricle as the most anterior. Okay, the most anterior is the right ventricle. Now the left ventricle is the most thick, obviously. So this is also an identifying feature of the left ventricle. This is an easy cross section. Yani. Also, people forget the descending aorta, so don't forget about it. Now, this is the last slide. This is a pop quiz. Which level are we in, first of all? T3, excellent. Why? The identifying feature we said is the pattern of the 3 arteries over here. You can see the left brachiocephalic vein and the right brachiocephalic vein. They're about to join to form the superior vena cava at the level of T4. So the superior vena cava forms at T4, not at the not at the level of the sternal angle. This is also a common mistake people fall in because they see the superior vena cava. They say, "Khas, we must be below the sternal angle." That's not the case. They join before the sternal angle, forming the superior vena cava. And you can see the trachea and the esophagus. Okay, that's it for me. You guys have any questions? So before you leave, please scan the code for feedback, and thank you so much for attending.